Dr. Madeleine Herman. Today we're going to be talking about what to expect after your sinus or nasal surgery. Sinus surgery is to open up the natural passages of your sinuses so that you can breathe better, have less sinus infections, and feel a lot better. Before your surgery, we're going to want you to stop taking any sort of blood thinners for at least a week. That's going to include ibuprofen and Aleve or other NSAIDs, as well as aspirin. Now, of course, we want you to discuss this further with your cardiologist or with your primary care doctor if you're on blood thinners for a heart problem. Also, before surgery, we want you to stop eating after midnight. And the reason for that is not because we just want to torture you. It's because when we give you medicines to relax you during surgery, that also relaxes the sphincter. When we give you medicines to relax you, it also relaxes the muscle that keeps food and drink down in your stomach. So if you eat or drink something, we run the risk of those liquids coming up into your airway and causing a really nasty pneumonia. So we want to make sure that you don't eat or drink anything before surgery, but luckily normally surgery happens early in the morning, so you're not left eating for 2 days. After your surgery, you're going to notice that you most likely have some splints on the inside of your nose. They're kind of hard to see on the outside. They're made out of a soft silicone in the shape of a D like this, and they're holding everything in place and keeping your nose nice and straight. We want you to make sure to use lots of saline, rinsing multiple times a day, and the job of that is getting all the blood and crust out of your nose to help you heal better and to help prevent scar tissue. You'll expect to have some bleeding for about the first 48 hours after surgery. That's totally normal. You're just going to tape a little bit of gauze underneath your nose and just fix it to your cheeks and allow the blood to gently ooze out of your nose. If you're noticing a bit of a drip of blood, make sure that you have some Afrin on hand and you can spray with that Afrin to decrease the amount of bleeding. Clearly, if you're bleeding copiously, we want to know about it. So call us. We always have a doctor on call to give you further guidance if you're bleeding aggressively. But you should expect some bleeding about the first 48 hours after surgery, just because the area of your nose can't necessarily use stitches everywhere. Also after surgery, we're going to give you an antibiotic. You're going to use that for about a week, or at least until those splints come out of your nose. We're going to give you a pain medication. Most people don't use it for too long. If you feel more comfortable, you can also take alternating Tylenol and ibuprofen. After surgery, you can eat or drink whatever you'd like. I'd say most people prefer to stick with a bland diet for the first 24 hours or so after anesthesia, just because anesthesia can make you feel a little bit nauseous. If you're taking a narcotic, it may make you feel a little bit plugged up. So feel free to take an over-the-counter stool softener if you need to, but I would say most people only take a narcotic for maybe the first 3 days. Really, it feels more like uncomfortable or stuffy, kind of like you have a bad cold, or frankly, probably how you're feeling right now before your surgery. At your first follow-up appointment, we're going to be removing those splints, as well as suctioning away a lot of the blood and boogers that are on the inside of your nose, and you're going to feel a lot better. Even after that appointment, we're going to want you to continue to rinse your nose of saline to help your nose heal and prevent crusts and boogers from causing scar tissue on the inside of your nose. As the days go on and weeks go on, you're going to be feeling better and better, breathing better and better, and you're going to notice that you're getting less sinus infections, less facial pressure. You're going to be feeling a lot better. If you have any more questions about what to expect after your sinus surgery, please feel free to give us a call. We'd be happy to chat with you. I'm Dr. Madeleine Herman with St. Houston in Houston, Texas. We serve patients in all over Houston and Memorial, as well as far out as Katy. We hope we can help you. Have a good day. Schedule your consultation with one of us doctors here at St. Houston, and we'd be happy to help you.